Hello, and welcome to the CareRight demonstration, Medical Specialist Billing Workflow Automation. Now, in this particular example, we've configured a demo environment of CareRight to show you just one way that we could automate the medical consulting through to billing side of the practice. Just to explain, CareRight is very configurable, and we like to review any workflows or business processes that you desire, and then we would like to configure a CareRight environment and come back to you and show you just how CareRight can deliver upon those things. But as I said, today this is just one particular configuration example, which again is medical specialist billing workflow automation. Okay, so where we're going to start the consultation today is we're going to start at the medical specialist ready to undertake some consultations on some patients, to undertake those consultations through clinical assessment, which would feed directly billing item numbers into billing automation. So where I'm going to start, I'm just going to go to appointments, and I'm just going to populate my day for Dr. Chris Hemsworth on the 15th of August. As you can see, I've selected the calendar view for Chris Hemsworth. We can generate any type of calendar view that you desire. And in this particular example, you can see I have a green session type, which indicates general consulting, and we have this brown like appointment type, which is just a general consultation. Our appointment calendar is very configurable. We can color code, we can generate calendar sessions for you, we can assign particular appointment types to those calendar sessions. And drilling down a little bit further, if I just go to list view, which provides a really nice jump off screen for the specialist to use on this particular day. Getting back to my point, the further drilling down, the way we can configure your appointments is we can associate a particular form with a particular appointment type. So you can see for this list view on the 15th of the 8th, Chris Hemsworth has his calendar for the day. At 10 a.m. he has Maggie Carlson, at 11:30 he has Andrew Anderson, and at 1 p.m. he has Graham Smith. At any point, anyone in the practice can update the progress of the patient through the clinic. These are all user definable, so we can actually set these to whatever you want them to be. Also from this page, if we right click and open up a new tab, we can jump into that patient's account, maybe to review previous diagnoses or clinical notes or anything else associated with that medical record. And the drop-down box allows us to directly invoice or do correspondence or edit the appointment. But getting back to our particular workflow example today, we're a medical specialist, Chris Hemsworth. We're about to take Maggie Carlson into clinic. So we're going to hit form, which generates our consultation assessment. Now, don't get bogged down on the detail here, because this can really be whatever you want it to be. It can ask whatever questions you want, making full use of our smart form capability. You can see it's automatically generated the information we already know about the patient into the smart assessment. We can put in some detail here. Let's just check a few boxes. Again, don't get bogged down the detail. This can be whatever you want to work through as part of your clinical consultation. But getting back to the workflow, we're going to put in some billing item numbers. We can put in as many as we want, or we can select non-billable, but this one we want to bill. So we're going to hit approve. Perfect. So as you can see, this appointment schedule has been updated. That form has moved from an editable form to a locked away form in the clinical file. If you did want to keep that form as an editable form, you could save and continue for later instead of hitting approved. So that's the clinical consultation complete on Maggie Carlson. Now we'll pretend that we're a member of the admin group out in reception. All admin group would have to do is go to events. The way we're describing events in this scenario are billing items. So you can see for Irene Carlton here, she has 3 billing events. This would be in a particular example that maybe she has seen a nurse, then a doctor, and then another doctor, and they've each added billing item numbers to her event. Another example might be if you're seeing a patient every day for a week, you can continue to add billing events to their file for them to be invoiced as a whole at the end of the period. But getting back to our patient, Maggie Carlson, we can see there's one event that makes sense because we did one clinical assessment and added 3 billing item numbers. If we hit show here, it shows all those billing item numbers that have automatically populated. If the doctor had left one out, we could add a new one just by going new and adding in a new billing item number. But for a nice streamlined demonstration today, we want to click select all and we want to click invoice. It's automatically generating the patient's health fund, but we could change the guarantor if we wanted to. We're just going to hit approve there. And perfect. As you can see, event assessment has been successfully approved, which means all of these billing item numbers have been populated into an unpaid invoice and would be waiting for us in the patient's account. So you can see we're in the patient's account. Let's go down to invoices and credits. Here we go here. Here is our invoices from today. Dr. Chris Hemsworth, invoice number 60, date and time stamped. We can see how much the patient's out of pocket. If we wanted to look at this in a little bit more detail, we could click on it. It's a hot link. You can see the invoice has been raised, but yet to be paid. So at this point, here we again can see those item numbers that we'd put in there. We could adjust or edit them if we needed to. And at this point, we could either, if it was a private payment, we could pay in full or pay out of pocket and collect that money, or we could hit claim, which would send that off to the health fund, or we could print this, this invoice out and give it to the patient. So that concludes our demonstration today, focused on medical specialist billing workflow automation. We could actually take this one step further and completely automate the billing so that when those item numbers are populated into that clinical assessment and that clinical assessment is approved, they could automatically populate into an unpaid invoice in the patient's account. But today we've shown you, just to simplify it, an added step, which would be admin intervention to populate that invoice. Thank you for your time and would welcome any questions you have.